In this video, we are going to be placing a resin sealant. There are essentially 3 steps to that. You first want to pumice the tooth, and then you want to etch the tooth, and then you'll place your sealant material on it and light cure it. So we've got our prophy cup here with some pumice stone. We've got our sealant kit with our 2 tips. Blue, this is our etchant, simply screws on, and then this is our resin sealant, comes with a little brush tip on there, and I've highlighted our grooves here because they are a little difficult to see on these plastic teeth. So this is our maxillary molar, and this is our mandibular molar, a little different shape to the central groove there. So first step is we'll hook up our motor. We're going to wet down our pumice paste a little bit. Mix this well together. So a nice slurry. Got it on our end there. And then you just want to, sorry, hand piece was not locked together. Slowly go over that entire tooth, polishing it up just as if you were polishing a normal tooth. Only takes a few seconds going around. Then I am going to, off to the side, spray that off. And ideally, while in someone's mouth, you want to keep this isolated, whether that's using an isovac or a rubber dam or an assistant with a high evac suction and some cotton rolls. So then you just take your etchant, place it over. You want the tooth to be dry, and you want to go in all of the little grooves, making sure you go down the side of the teeth as well. That takes about 15 to 20 seconds to work. And we'll call that 20 seconds. Off to the side. Use my spray water. Rinse that off. If you're using this in a patient's mouth, you want to collect that with your suction. The etchant is very bitter and acidic, and it will burn the gingiva. So now that that's dry, you can come in with your etchant. It can be a little hard to push out, and you're going to simply go over the grooves, just brushing it on. It doesn't take much, and it does light cure, so I have our curing light, making sure you go down the side of the tooth where all those developmental grooves are. And if you place a little too much, or if you touch the adjacent tooth, you want to get that off of there before it cures, so you can take your Explorer and just lightly go over that. We'll go ahead and cure it. Cure for about a minute with these lab bench lights, 30 seconds to a minute. And then you can go back over it with your Explorer and feel that it's hard. Go around all your edges. If you can get your Explorer underneath an edge and pull up, it means you did not isolate it well enough, and that it will come off within a short period of time of the patient chewing. So there's our first resin sealant. A little difficult to see, but hopefully you understand the process.